It began with greasy glasses, or so she thought. Stacey Terry later realized it was early onset cataracts in both eyes. She was given a 5 to 6 month wait for surgery, which passed without updates. So she called her doctor's office.
And she said, "Oh, I'm terribly sorry, but they're now booking into January and February of 2026.
Terry has been cleared for daytime driving, but with daylight hours now decreasing, she's concerned she won't be able to properly look after her aging father or herself.
It's just frustrating to know that there's this quick thing you need that would make such a difference in your life, and the irony is you have to wait 8 months to get your 30-minute surgery." Come here.
Terry's wait extends beyond the Canadian Institute for Health Information's benchmark of 16 weeks for cataract surgery. According to online provincial data, the median wait time for patients who got their surgery in 2025 was about 12 weeks from consultation with a specialist to surgery. That's up 3 weeks from 2024. Median waits for hip and knee surgeries and replacements are also up from last year. Dr. Ed Buchel with Shared Health argues waits may appear like they're increasing when overall the healthcare system is making progress.
The way we report the wait times doesn't reflect the fact that we're delivering more care today than we did last year, than we did the year before.
Shared Health launched a centralized system last year called SWIM, or the Surgical Waitlist Information Management System. Buchel says SWIM is helping prioritize those who've waited the longest because it tracks everyone who needs surgery. This is different from before when waitlists were tracked by individual surgeons, sometimes in an Excel spreadsheet or a filing cabinet. Buchel says that's part of why the monthly waits on this online dashboard appear longer. He says Shared Health's internal SWIM system already has data on what the average waits are and more, but that information is not available yet. He says some of it could be published by early next year. CBC News asked to see some of this data that Buchel claims shows the healthcare system's progress, but Shared Health says it won't be available until the new website is ready. Health Minister Uzoma Asaguera says the province hasn't decided how, what, or when the information will be shared. In the meantime, Buchel says Shared Health has boosted the annual number of surgeries for cataract, hip and knee, and spinal surgeries. For cataracts, provincial data suggests nearly 1,800 more cases were completed in 2024 than in 2019.
All we have to do is stay on that. So everything we do by 2030, we will have 0 people waiting outside of benchmark wait times.
A long time, 4 or 5 years. Just these ones.
That's cold comfort to Mandy Grove, who lives with chronic pain every day. She's been waiting much longer than Shared Health's current average of 7.5 months for spinal surgery.
There's days where I can barely move without sharp pains all down my back and all down my legs, where I'm stuck in bed or I'm stuck in a chair.
She was referred to a spinal surgeon in early 2022 to fix her fractured spine and slips in her vertebrae. An assessment with the spine clinic in 2023 finally led to an online meeting with a surgeon in November 2024. They told her the wait for surgery could be close to 2 years.
When you're 41 years old and your entire life is taken from you because you're literally being crippled from something that can be fixed, it's extremely hard to swallow. I can't do the most basic tasks that I want to do to be the wife and mom that I used to be. So that's very, very hard on me and very hard on my family.
In April 2024, the Manitoba government announced $12 million for a new spine program. Buchel says it brought new equipment to hospitals and has just about doubled the number of surgeries. Grove wonders why she's still waiting. Rosanna Hempel, CBC News, Winnipeg.